I'm Mike Patterson, and we have with us today Dr. Maimouna Azar, founder of Telegenz. Hello, Dr. Azar. Thank you for joining us.
Hi,
Um,
Mike. It's a
um,
pleasure. Thank you so
yeah,
much
it is a
for
pleasure.
having
And
me.
you're in Dublin, Ireland.
That's correct.
So how's the weather
Absolutely.
there this morning?
Very pleasant. It's 12 degrees Celsius.
Oh,
Feels like the
awesome.
spring is already here.
Excellent. So why don't we jump right in and tell us a little bit about yourself and the story behind Telegenz.
Sure. So Mike, I'm a medical doctor, as you know already, and I happen to have a background in software development, which comes through a very informal training, as in I went for my IT training in the evenings of my med school. So fast forward to the pandemic, when unprecedented times called for unprecedented measures, and we were using conventional video platforms for a lot of things, even for things for which they weren't primarily designed, such as for training and assessment. I did the same, being a clinical educator, and I used them for teaching my students who weren't allowed on the wards. So one day, while I was trying to set it all up, we had the students located in a remote place, and I myself was on the ward with the patient. Everything went wrong on that very first virtual tutorial with a real patient, because until then they were doing it with a simulated patient in a very controlled environment. And on the ward, it just didn't work. The patient got screen fatigued. Very soon, he was like, now another question, now another person. And it just didn't go any more than 10 minutes. So that's when, I wore my software developer's hat after many years and brought together my two knowledge domains and my experience as a clinical educator for over 12 years and designed this platform, which we call Telegenz, and about which we are talking today. So essentially, the idea behind that was pandemic would get over, but there was one thing which was sure to stay, and that was telemedicine. And it's a shame it has taken this world a pandemic to unleash the potential of this technology. But at the moment, we're talking about a 35 billion US dollars telehealth industry that has grown exponentially, is continuing to grow, but there's a skill gap. So, and that skill gap is in remote patient assessment. We need to train the practitioners, the future practitioners, that is our students, and even the patients, so that they best leverage the existing and evolving technology. So I identified that piece as my niche and developed this platform. And I'd like to show you my next slide here, which helps you differentiate it between it from the conventional video platforms. So basically, those platforms like Zoom or Teams or Blackboard Collaborate were never designed for training and assessment. And then I'm often asked, why can't we use the existing telemedicine platforms that are there in plenty? So I definitely did not reinvent the wheel. Um, Telemedicine platforms are for service delivery. They were never designed for training and assessment or accreditation. So Telegenz precisely fills that gap. There are a few platforms where there are pre-recorded videos and lectures that guide practitioners to learn telehealth skills. And our differentiator from them is that we are a real-time live teleskills training platform. So it's a virtual hands-on experience for the practitioners or the students who are trying to learn remote patient assessment. It's all consent-based. So it allows to engage with the real patient with their consent, and patient can agree to choose their data with us over this virtual platform. So they get to engage with this real or simulated patient, whatever the setup is at their organization, in the presence of a master trainer. So they get a very structured feedback at the end of the session, and it's all done in a synchronous real-time manner.
Wonderful. Now, what audience is this for? Is this for medical students, or is this for, any healthcare professional, or, how does that all work and play in?
Sure. So basically, telemedicine again makes it feel like, it's just for the medicine. So I prefer to call it telehealth training as opposed to telemedicine training. Telehealth training stretches across all healthcare disciplines. And I had that in my head right from the very start. So this particular platform, Telegenz, is fully customizable, and it can be customized across any healthcare discipline to any training's needs. So not just the healthcare disciplines, but also the level of training that we are referring to, as in if they're the first year medical students or first year physiotherapy students versus the final year, graduating class in the advanced nurse practice students. So we have validated Telegenz across School of Medicine, School of Physiotherapy, for a master's program in advanced nurse practice. We are currently running a telepharmacy pilot in the UAE. And yes, we have even piloted it with physician associates. So across various healthcare disciplines, it's usable.
Great. So I'm assuming um, that you don't have lab patients involved in this, so there's no health information going. Does it is your platform HIPAA secure? Does it need to be?
Yes, so basically, that's the beauty of Telegenz, that you can engage with real patients who have their own data. Now, it is HIPAA compliant. The region that we are based in, we need to be GDPR compliant as well. So, and then telemedicine or telehealth is not restricted to any region now. So we are actually compliant with data obligations globally, which qualifies us for being used in global health use cases. So that piece has been taken care of. It is consent based. So when the patient participates, if they want, they can actually remove their patient identifiers, so they can take care of that while participating on the platform. And if they wish, they can participate with their identity. Again, they are giving the consent. They cannot log into the session unless they have consented to take part in the session, which is a training session, and they consent to sharing their data, including pictures. Because if it is a patient, who wants a wound review done, they want their scar or wound review done, and that's the assessment which the trainees are learning, the resident doctors or the medical students, with their attending, then it's going to be the pictures as well. So, the consent is detailed, and by default, we do not record the session. So that feature has not been provided on the platform. And that's in the interest of both the patient and the institutions. So, yeah. The end buyers, precisely when we look at the telehealth education piece, would be the university programs. So they are the ones who buy the subscription of the platform for their trainees or the students and the tutors. Patients participate for free, because obviously every time you would have a new patient, so it's just the patients who sign up with the university to help the students in or trainees in telehealth education. They are reached out, but there's no separate cost for the participation of the patients engaging in this entire exercise.
Thank you. So it is a subscription-based product. That's how that
Correct.
would work. Okay.
Absolutely. It's a SaaS
And
platform.
depending on the number of users or the length of time you're using it, I would assume, or
Absolutely.
okay.
Absolutely. So, like for the university programs or for hospitals who are training their resident doctors, um, the baseline fee that we have is $50 per user license per month, and that is unlimited use during the month. So that's what it is capped at. But obviously, for let's say for global health education or for global health service delivery piece, it would be session-based, and then every session would be of a different duration. So we provide custom pricing for those use cases. And same goes for patient education, because it would depend if it is a telehealth company which wants to educate patients in how they can best leverage telehealth technology and how they can appropriately share their data with the physician they're attending through a virtual platform. Then for them, for training them, it would be a different dynamics, and there would be a custom price for those kind of sessions. That would be based on per session as opposed to per month. That works better for universities, but not for these individual use cases.
Thank you. I totally understand that. So, and maybe you're going to get into this, but what about implementation and support? These are, how do you do that?
So basically, there are two ways of doing it. One is we have the share screen option. I can actually show you the screenshots in a while. I think it will make more sense, and you'll be able to relate to it better. I'll just change my slides here if that's okay. So here, Mike, is the patient user interface. So what happens here is we have kept it as simple as possible for the patient, pretty much like the WhatsApp video call, so that they don't you don't have to spend hours training them how to use it. It will be intuitive enough for them to actually just look at it and figure out how best they can use this particular interface. There are two features here that are of benefit from training perspective. One is that at the end of the session, they can send their feedback to the moderator of the session, which is usually the master trainer as well. And then also they could share their data from their wearable devices during the session. So what will happen is they'll get a prompt from the master trainer that we are looking for your glucose data, and they say yes, and then the data goes to them. And then likewise, they can share their pictures of, like I said, like of a new skin, a mole or a scar or an ulcer. And that can be taken in their own time, a high resolution picture, instead of moving the camera awkwardly during the session. And the tutor then does not share it randomly, rather they share it at their discretion at the right point during the training, because any data that is shared by the patient doesn't go flying around to all the participants. It goes only to the session moderator, and they have the responsibility of reasonably using it and sharing it at the right time during the training session. So that's about them. But when it comes to sharing data from the likes of Epic, in that case, let me show you the tutor interface. So this is the tutor interface. You see the patient here. These are the students, very relaxed in their own environment. And then here is the tutor, who is the master
Can I
trainer.
stop you for one moment?
Yes, sure.
Because you mentioned Epic, and maybe we
Yes.
can answer it a couple of questions at once. So it does interface or integrate with a EHR?
Yes, so that's what I'm coming to
Okay.
basically. So there is possibility to integrate as well, and for that we'll have to work with Epic and as well as the institution requiring that particular customization. But the other way of doing that is literally by using the share screen option, because the purpose of Telegenz is to train the resident doctors, for example, or the medical students in remote patient assessment. They're not providing a consultation at that point in time. The consultation is being provided by their attending, who may be this person, who may not be this person. This patient here can be the inpatient, or it can be the patient participating from the comfort of home, being nice to the students and taking part in the educational activity. A good few patients would actually be happy enough to contribute to the training of future doctors or nurses or paramedics or physiotherapists. So basically, without any integration as well, you can share the data that is being considered by simple share screen. And if the integration is required, then that can be done. What we currently have in place is basically capturing of the data from patient wearable devices, which the tutor can call into the session with the consent of the patient and then have that discussion, clinical discussion about it with the students. So that can be done. But with Epic, we can do the customization and integration that's needed. And if an institution can make do with share screen, that's an option as well. So this is what the tutor will be able to do for the rest of the group. The students will not have direct access to it unless it has been shared by the tutor. Um, have I answered your question there?
Yes, you have. Thank you. And so I'm
Perfect.
thinking this would work for rounding, for virtual rounding. And
Yes.
so you're educating and rounding at the same time. Good.
Absolutely. It's just like actually doing multiple tasks while teaching remote patient assessment, everything in one go on the same platform. So, it would definitely enable multitasking from that point of view. The other thing, while we are at the interface, and I would like to share with you, is this is the tutor interface. So the tutor basically spotlights, one student at a time, which basically means they're assigning that trainee to speak with the patient. And then what happens is they keep writing their notes, as in who did better, what else could be improved, because it's very difficult to interrupt in between the virtual session, which you can easily do while just whispering if it's a bedside teaching happening in the hospital. Um, the trainee, on the other hand, writes down their clinical documentation the way they would do on the electronic health record platform that they may have in their hospital. So this is basically a very good practice for them to adapt good clinical documentation practice, and they could do this here. At the end, once they click on the compile feedback or compile notes, system generates a PDF that gets stored here in the cloud for them to access later for relearning or revisiting the experience. But also, if it was to be sent to the attending, they can send to them. And if it needs to be sent to the students or the trainees by the attending, they could do that as well. And the feedback goes to each of the students. You could even customize your feedback for a particular student. So there is that level of flexibility. All the notes you take along these tabs that you see here, history, exam, differentials, that all collates into one single PDF. And you were asking me about the other healthcare disciplines. So basically, we have School of Physiotherapy here at the Royal College of Surgeons in Ireland, using it for 3 years in a row at this stage. They have completely different texture in the tabs because they do the SOAP assessment, as they refer to it. So the text on these tabs is different for them. It's pretty much similar to what you're seeing for advanced nurse practice, but obviously if we go into telepharmacy, they as well have completely different text here. So it's all
So you
customizable.
so your company customizes depending on the discipline as the customer
Absolutely.
needs it.
Absolutely. And basically, the whole platform comes with its own admin portal, which is very intuitive again. And so their own admin can do it as well. We can provide them the training, and then they could do it. It's really very user friendly. So in a matter of few minutes, it can all be sorted, and they can customize it even to the level of education, as I mentioned before, like first years versus final years, that can be done. So, and then no training is complete without assessment or accreditation piece. So this is our exam mode. And what you see here is obviously one student at a time, the patient, the examiner, and then this particular person here, which says examiner and observer, is basically, it's optional. It's not mandatory. Some licensing exams need two examiners. Sometimes you need an external examiner to pop in. At times, you're training someone to become an examiner or a simulated patient, so this slot can be used for them. Anything you see here, again, is customizable from scratch. You could even have, the likes of NBME or any other clinical exams that can take place virtually can have their marking sheets fed into the system, and that would appear here. So these are the two components, the training and the exam mode, that I have just shown you.
So, I guess the use cases are there are tons of use cases you can use.
It's just
Have
down
you
to
used
your own creativity, really, to the end user's creativity,
and
how
so
they'd like to use it. Like, honestly speaking, I started it with telehealth education, and I did foresee that it can be used in various other situations like patient education and global health,
Mhm.
even at business schools for that matter. Um, but people started coining the use cases by themselves, and they were like, okay, so I want to use it in my clinic. So currently we have a professor of pediatrics who is piloting the platform for an intervention that she has designed for neurodisability, and it's called Happiness Toolkit, and she's using it for Train the Trainer. And later on, she wants to extend it, for bringing in the patient with their family members and use it in her clinical service. Because especially for kids, it's not just the parent, it can be the sibling who is their carer, it can be the grandparents, and it's not practical to bring all of them on board in physically in the clinic room. Whereas virtually, they all can participate. And then on Telegenz, as you see here, they can actually take their notes. So, and it will go into their email as well. So, instantly at the end of the session. So they can always revisit all of that, and make their notes as to how they're going to take care of that kid once they are the carers for him or her. So,
That's interesting, and I totally understand that. So this could also be used. Um, I'm just thinking of other use cases, but it could be used in a caregiver situation for
yes,
patients with elderly patients with dementia, or
absolutely.
and also
Absolutely.
research. It could be used for research.
Absolutely. Yes, you're absolutely right. Like, for clinical research organizations specifically, when they are training their new researchers in informed consent process or good clinical documentation process, they could actually use the exam mode for that. It could be the consent form for the clinical trial here, as opposed to the OSCE sheet that you're seeing just now for osteoarthritis. So, yeah, all of this can be done from scratch, and they can do it themselves, literally within a matter of few minutes. So it's all doable.
Gotcha. You've answered a lot of questions. I'm not sure what else you're going to tell us, but I mean, do you have um, more data or more use cases that you'd like to share? I do have one last question.
I'll take your question first.
Okay, great. You mentioned pilots early on, and I know, companies need to make money, but so what does a pilot look like, and what type of yeah, what does a pilot look like, and what type of customers would qualify for a pilot?
So basically, the first so the pilots are of two types. The first one was that the institution had recently, incorporated telemedicine or telehealth into their curriculum, and they wanted to test it out before rolling it out into the curriculum officially, and for accreditation and things. So it was their pilot, but it was a paid pilot for us. So they paid us. And in fact, our minimum viable product, our MVP, as soon as it was made, we were coming out of the first lockdown. So, things were not fully open at that time. And we had our first two clients um, who were paying customers using that MVP. And based on their feedback, we incorporated all of the user feedback from 250 users from those two pilots and informed the new interface that you have just seen. And this particular interface, actually, I forgot to mention earlier, has AI integrated translation to transcription facility as well. So actually, it helps you engage with a more diverse cohort of patients as well as trainees, because it allows you to do all of that. And we don't use any of our users' data to train an AI model in the background. We use Microsoft's pre-trained AI model in our platform. So basically, coming back to the pilot, even the pilot that we are currently doing with the professor of pediatrics, it's a pilot for her because she wants to use the data from this experience to write up a grant. So it's a pilot for her, but she's paying us for that. But at the same time, there are two programs who would like to evaluate Telegenz before they, get into a fully subscribed contract with us. And we are facilitating that as well because, obviously we would like to see Telegenz being rolled out into institutions and various other use cases. So yes, we have both types of pilots going on. The pilots, which are pilots for the end users and not really for us, and the pilots that are for us, because, for example, if there is a university in the US which wants Epic integration and they want us to work with them and make it work before going into a fully subscribed package, we could get them a pilot for evaluation at a highly subsidized rate and work towards making the integration work. Once everyone's happy, we get into the fully rolled out package.
So where do you see Telegenz going in, the next, I don't know, next 3 to 5 years? What's the roadmap?
So at the moment we are already in talks with clients that are, in their final stages in various parts of the world, which includes Ireland, UK, UAE, recently Australia, and in the US as well. I've been in touch with 5 university programs, and we're looking forward to working with them by the end of this academic year. We are hoping to finalize the deals. So in 5 to 10 years, I'd really want to see Telegenz being the pioneering leaders in telehealth education space, because all the other use cases that I have mentioned, be them in global health, patient education, clinical research organization use cases, if you reflect on them, they are all telehealth. In principle, they're all telehealth. So yes, education and training accreditation is what we have identified as our niche, and we would want to see ourselves as the leaders in that avenue.
Thank you. Yeah, I don't have any, any more questions, unless you have something to add. You have?
Not really. I think it was really nice sharing all these details
Yes.
with you, and the future plans, especially, our the AI developments that are work in progress at our end. I'm really excited about them. So I think we have talked about all those things, and if you're thinking about any other question now, I'm more than happy to take that. But no, it was really nice talking to you,
Yeah.
Mike. Thank you
Nice talking to you.
for having me on board.
Well, Dr. Azar, thank you so much for speaking with us, and I really appreciate your time.
Thank you very much. It was a pleasure speaking with you today. Thanks a million.